Okay, welcome back to Dr.JIN's channel. Previous video, we talked about the gastrin-acid negative feedback in the gastric phase of acid secretion in your stomach. This time, in this video, let's see some patients. And these patients all have some problem with their serum gastrin levels. Okay. This table shows several patients, several disease. The first one is a duodenal ulcer. The second one is gastrinoma. The last one, pernicious anemia. And this patient all has some problem with their serum gastrin levels. Okay, let's see one by one and explain to you. But think about, you should use the last video's knowledge, gastrin-acid feedback, to try to explain by yourself why in this kind of patients, the gastrin level in serum is kind of abnormal. Let's one by one. Okay, in a normal patients or normal person, the gastrin level in the serum is 35 picogram per ml. Oh, you will immediately see, oh, see, the gastrinoma is so high, 500 ml. Okay, yes. Why? Because the gastrinoma actually is a tumor located in the pancreas or in the small intestine. This tumor can automatically secrete gastrin without follow the rule of the gastrin-acid negative feedback. That's why whenever it secretes gastrin, it all secreted from the tumor, not in the stomach. That's why their release of gastrin is totally out of control. What kind of control? It should be based on the rule for gastrin acid secretion, gastrin acid negative feedback. Let's see another one. Pernicious anemia. The pathophysiological foundation for this pernicious anemia is, in this patient, there is autoantibody to attack bladder cells. That the number of bladder cells is dramatically decreased because the antibody destroy the bladder cells. Then what means? Actually, in this patient, acid secretion is very low. Okay, the acid secretion is very low. What does it mean? There are no inhibitory mechanism to gastrin. Because once your pH value is very high, it will not stimulate the D cell, which is located to the entrance of the stomach, to release polypeptide. What's the name? Somatostatin. Without the somatostatin release, G cell can increase release of gastrin to the circulation. That's why in the pernicious anemia patients, because there is no inhibitor mechanism of somatostatin, the gastrin level in serum in these patients is dramatically high. Okay, but the interesting point is why beta level hydroion is almost at zero. And also, after the pentogastrin stimulus status, this patient also very low level of the acid because there are almost no bladder cell secreted gastric acid. So that's why all the acid level is very low, almost is zero. Okay, in the duodenal ulcer patient, the gastrin level in serum is also a little bit high compared with normal. What does that mean? Actually, in this kind of patients, the somatostatin level is decreased. Also, if your somatostatin level is decreased, it will not inhibit the G cell to secrete gastrin. Then, in this case, the gastrin level in blood will dramatically increase almost 30% compared with normal patient. So, in this case, you can see in the beta level, the hydrogen secretion in the duodenal ulcer patient is also a little bit high, like in the 7, and normal is up to only 2. So what does it mean? Because if your gastrin level is high, remember, for the physiological function of gastrin not only increase the gastric acid secretion, also will induce growth of the product cells, also will induce growth of the eosinophil cells. That's why if your gastrin level is high, your product cell number and the eosinophil number will increase. That's why the basal level of the hydrogen ion secretion from the duodenal acid patient is high compared with normal patients. Okay, so in this table, you guys need to think about more. And if you have questions, let me know. For the next video, we will talk about if the food enters your small intestine, what do I have? In the small intestine will stimulate the gastric acid secretion or will inhibit gastric acid secretion. Okay. This is today's video content, and thank you for your watching, and see you next time. Thank you so much.